Hey there, and welcome to week 3 of the Somatic Nurse Coach Certification Program. I am so excited to meet you here today in this space that we talk about inflammation in the body. And so, before we begin today, we're just going to start off with a simple meditative practice. So, go ahead and find your seat, find your feet on the ground. Just take a moment you can soften your gaze, you can look down at the ground, or you can even close your eyes. Take a moment to notice yourself in a whole state, not a broken state, but a whole state. And coming to the awareness of the breath, taking a nice deep breath in. And open mouth, sigh or exhale, let it go. Bringing the breath inward, inhale deeply. And exhale, let it go. Good. One more time here. Inhale, bring a smile to your face. Reach the arms and hands towards the sky. Go ahead and open up the shoulders, the chest. Take your chin into your chest. Stretch out the neck. And then go ahead and round your back, bringing your hands together, extending them upward one more time. Opening up, bringing your elbows towards your hips, allowing your hands to drop down as well as your shoulders away from your ears. Take a nice deep breath in. And exhale. All right, so let's go ahead and catch up with what we've been doing thus far. So let me go ahead and share my screen with you guys. All right, so you should already have that book printed out or even saved. It's this one right here, The Healing the Trauma. And as we scroll down here, these are some of the things that we talked about in week 1 in module 1. So make sure you go through these books just to look at the different parts of the brain, looking at the different theories. And then also as we move through here, we talk about fight, flight, fawn, or freeze, and then trauma onto the nervous system. We keep going. This is such a lovely picture. I mean, it really does amplify how and where our nervous system goes, which is so cool to see. So as we move down here, make sure you understand the polyvagal theory. So there's two pathways traveling in the vagus nerve. We have a dorsal vagal and we have a ventral vagal. So the ventral vagal is when we are responding to cues of safety, but we also support feelings of being safe and socially connected. So we want to be in this ventral vagal state as much as we can. But a lot of the times we are responding in a dorsal vagal from our kids that are in school, from being at the movie theater, or even in a place where there's a lot of people. You might go into a dorsal vagal state, which is responding to the cues of danger, a protective state of collapse. So when we feel trapped or numb, we know that the dorsal vagal has taken control. So this is going to be very important in understanding trauma as we look more into what this all entails into our nervous system. And this is just a little bit of expansion. And again, you can use this with your clients as they learn about their nervous system, since we're not taught that, because if we were, then we would really truly understand our true power. The polyvagal theory was developed by Stephen Forges. It's a neurobiological theory that explains how the vagus nerve plays a key role in regulating psychological and emotional responses to trauma, stress, and social interactions. So it's a theory, obviously, and it's an interesting theory because if we look at the middle here, we see stabilization. If we look at the right, we see parasympathetic, which is the brakes. It puts on the brakes from excelling. And then we have sympathetic, it is the opposite. It's the accelerator. So what he was in suggesting about this kind of state is we think of this as if we're driving down a highway. So we need both of these functions, right? We need to accelerate and we need to also brake. But in the same process, we need that to apply to our mental, physical, and emotional functioning as the drive or the flow, right? So it's an important flow between braking and accelerating is the emotional response. So what he's stating is that the body is constantly trying to find a state of safety. It's trying to find this ventral vagal. But often in our society, we find that this dorsal vagal is really what we go to. And so it's important that we find glimmers. And these are activities that we can count on to activate the parasympathetic, the brakes, right, nervous system in letting our nervous system slow down, and it basically brings us into that like the ventral state or that co-regulated state. And we're going to dive in on this. So I think this is really important. As we talk about inflammation in the body, we're talking about trauma on the body. And if we look at a lot of our trauma survivors, we can see how it evolves their body from how they stand somatically, right? How they might be hunched over. But a lot of times we can't see inflammation because it's on the inside. We can see inflammation if it's on the skin, maybe a puffy face or a swollen joint. But a lot of times the inflammation that occurs from trauma is directly inside of our bodies. We can look at trauma survivors and trauma people who have experienced very hard trauma, that it actually changes their facial features. So you can get your facial features back by doing different facial yoga and actually getting to the root cause and addressing some of the trauma that you might have been through. It's all about rewriting our story. And as we rewrite our story, our body and face starts to change. And so does our mind too. So if we look at, let me go back here. If we look at the impact of trauma on the polyvagal system under chronic stress, this really gives us an in-depth look of how inflammation occurs in the body. So we're talking about PTSD here, or CPTSD, and it's chronic, right? So it's going to be chronically in that ventral vagal state. And so some of these mental and physical implications that can occur, we see here anxiety. So what does anxiety do in the body? Just take a moment and think about the symptoms for that. Right? We have increased heart rate. We might have increased motility within the gut or inflammation in the gut. Our physical state from anxiety, sometimes people pick at their eyelashes or eyebrows or even their hair, maybe their fingers, bite their fingernails. So anxiety does show up on the body. So it's really interesting to notice each of these and how they show up on the body, and if we relate that to an emotion. So here we have anxiety, so that's an emotion. But if we look at chronic pain and autoimmune conditions, sometimes these are related to emotions, but also focusing on these things can actually increase them, right? Because you're causing stress to the body, especially autoimmune conditions. So if you're having stress upon the body, this is when we see a lot of the time those autoimmune conditions popping up. We also see chronic pain increasing during times of stress or anxiety. We often see fibromyalgia, chronic fatigue, even headaches. These all cause inflammation, digestive distress, learning disabilities, confusion, anger. Much of this is related back to inflammation in the body. Inflammation from not eating right. I know I don't eat right. I live in America. It's very hard to eat a good, healthy meal here, and it really does affect our digestive system, also pain, autoimmune conditions, and really does amplify a lot of these conditions that we're seeing. So if we look at kind of pulling it all back together here, and this is going to go really in tune with why our body is in a state of inflammation. So if we look at the movement, the lack of movement, the lack of nutrients, the lack of support, the lack of social connection, all of these things cause inflammation on the body. But yet we are given medication to fix those things that are mostly in our environment. So it's kind of an interesting thought to think about here. So if we look at these core components, we have safe, mobilized and immobilized. We have the rest and digest, which is social and safe. And this is looking at the autonomic nervous system identifies as a safe environment. And this is when our body is in a good state. This is when we're thriving. Notice, rest, and digest. This doesn't mean you're having belly issues, right? You're social and safe. Mobilize is that flight or fight. And this is where you see much of that inflammation start to happen from that anxiety, that panic. The world is no longer safe, unfriendly, and dangerous. And we see a lot of this right here in our younger children, especially in grade school, middle school, and high school, because the constant threat of school shootings. So they might be in a state like this all day long as well. Now, mobilized or freezed or shut down, this is usually for survivors of trauma. This state is often the go-to state. So this is experiences dissociation are frequently associated with freeze, depression, numbness, and dissociation are commonly felt, but they can feel hopeless as well. And, it's really important to understand this. So let's go here to neuroception. So neuroception, yet again, it's our, it's feeling safe. And our nervous system is constantly scanning our environments to ask and tell our body, is this safe or not? So really it's our goal to protect us by sensing safety and risk. And it's paying attention to what is happening in and around our bodies and our connection to others. So this is the neuroception, and this is the awareness far away from our conscious control. It is not awareness that comes with perception, but the way our autonomic nervous system scans cues for safety, danger, and life threat without involving the thinking parts of our brain. So these neural circuits are everywhere in our body, and our body's constantly talking to us from our outside and our inside. And so this is really helpful if when you're in a neuroception safe and not dangerous, you can get that sensory data and basically it taps into that conscious thought. So if you feel safe around people, your body's going to display safety, openness, accepting, receiving. If you don't feel safe around people, your body's going to be cut off. So you might have your arms crossed, you might cross your legs, you might cross over. It's going to be a protection of the body. You might even go to a different room or remove yourself from the situation altogether. So when we're in a neuroception state, we feel safe in our relationships and we're aware of what's happening in relation to ourselves and others. So these are some really good worksheets that you can also check into because those are going to be helpful in, helping your patients and clients. So if you already work in a clinic or a facility, see if you can bring this type of care and education to your patients. All right, so these are just good. This is a really good worksheet right here. It's kind of a walkthrough. So, this is really good if you have mental health patients. Everybody is a mental health patient. If you work in mental health, this is a really good way to kind of walk through. So, do you have a tendency to fight? Right? And this is something good too for teachers, for kids that maybe just had a fight, like walk them through what happened? Do you have a tendency to flee? Do you have a tendency to freeze? Do you have a tendency to freeze? Reflect on your responses. I love this one. Draw your safe place here. That's a fun one to do with kids. Write about your glimmers. This is really important to have these throughout your day and notice them and share them with others as well. All right, what is the vagus nerve? Let's go ahead and get into that. So this is what I want to talk about because when our vagus nerve is feeling good, then we feel good. So I finally got my book. I'm so excited. So beautiful. I just had Canva bind it. It was like $30. Totally worth it. It's so easy to flip through. So it's totally up to you what you want to do. It's also easy just to keep PDF if you're not going to use it yourself. All right. the vagus nerve. So the vagus nerve is very important in our nervous system. It's responsible for controlling all sorts of functions throughout our nervous system and our body. It is also the longest cranial nerve and stretches from the brainstem to the organs in the chest and the abdomen. So pretty cool, right? The vagus nerve also regulates your breathing rate. It also helps with digestion and even certain aspects of speech. So trauma, when we're talking about trauma, this actually disrupts the function of the vagus nerve and can lead to a dysfunction in other parts of our body. So when we're talking about inflammation, it's really interesting because if we go to the doctor and we're like, my stomach's upset, a lot of the times they're not going to ask you about your trauma history. They're going to do a whole bunch of tests and then give you some medications and send you on your way, but you still might have those symptomologies. And so it's important to note that trauma really does affect a lot of our body, and it can lead to a lot of mental health diagnoses, and it also can lead to pain or chronic pain. And let me go ahead and drop this here. 1 second. All right, so when the vagus nerve is triggered, so what happens anytime your brain perceives a threat due to the sympathetic nervous system, it triggers the fight or flight response. So the parasympathetic nervous system does the opposite. It calms you down, whereas you're being pulled out of harm's way from ongoing traffic while crossing the street when your nervous system is activated. You are no longer distressed, you are at rest. However, sometimes the brain remains in panic mode as if you're still in danger. So the vagus nerves help us remain calm when we're stressed. It also helps with rest and digest. And it also helps with the parasympathetic has this high tone dorsal activity when you get in freeze mode. So if you aren't healthy emotionally, you are either in sympathetic, so fight or flight, or parasympathetic freeze. So you're either one or the other, or you're in between, just like in that co-regulated state. And it talks about the polyvagal theory here a little bit as well. So once a vagal response has been triggered, you may have a variety of physical symptoms. These include blurred or tunnel vision. You might have had these yourself, cold and clammy skin, dizziness, a lightheadedness, nausea, ringing ears, sweating, or even turning pale. So a lot of the times these are related also to shock. Those are shock symptoms as well. So the vagus nerve is involved in the rest and digest response of the body, which helps to counteract the fight or flight response. So understanding that the vagus nerve, a lot of it is going to be related to that overall health. And there are many different ways you can help activate the vagus nerve, and we're going to get into some of those here. So the vagus nerve is a key part of your parasympathetic rest and digest nervous system. It's going to influence your breathing, your digestive function, your heart rate, all which can have a huge impact on your mental health, which is a direct relation to your emotional health, which is in direct relation to the inflammation that might be in your body. And I know as I work with clients that are also trying to lose weight, it's really interesting when they start to try to switch their mindset, their bodies start to change. And it's really cool to see that. So resetting the ventral vagus nerve, these are some exercise ideas. The basic exercise, when you lie on your back, you interweave your fingers like behind your head, and without turning your head, you look to the right with your eyes, right? And remain here until you spontaneously yawn or swallow. So you look to the right. And then return to neutral state with head and eyes straight. Repeat on the other side. So this is just resetting the vagus nerve, which is really cool. You can do full salamander exercise, which you get on all fours. Your head is facing down. So it's like cat, cow, and yoga, but you're the cow. Look left without turning your head. Again, your eyes. Tilt the head to the left. Let the spine twist and the head tilt to the left. Hold for 30 to 60 seconds. Bring head and spine back to center, and then you're going to do it on the other side. The diving reflex with cold exposure, humming, singing, or gargling. So you can do that in the shower, or you can chant the word Om. And this is very common in yoga. If you've ever done yoga, you might have done an Om at the end of class or even at the beginning. And so this is just, again, some worksheets, and we get into co-regulation. So what is co-regulation and what does it have to do with inflammation? Well, when you're in a co-regulated state, inflammation will decrease in the body because you're connected to the two nervous systems, right? The sympathetic and the parasympathetic. So co-regulation is a tool for calming and protecting the nervous system during times of distress. It helps create an environment of safety and understanding through co-regulation. It involves various types of responses, but not limited to warm, calming presence, tone of voice, and verbal acknowledgement. The regulation strategies could look like this. So feel better, respond effectively to life's challenges, respond versus react, replacing emotionally charged reactivity with controlled responsiveness and resilience. So if you want to feel better, you're going to respond instead of react. If you want to think better and access higher learning and cognition, you're going to learn and retain important facts and concepts that enable greater confidence and social contribution. And the last one there is if you want to connect better. Let me get that up. It says build positive social relationships, develop relationships, and truly connect with others. So that's really important in looking at the state of inflammation bodies. It really comes back to understanding and knowing about the nervous system. And so this is one of my favorites here, and this is a really good one to start off with your clients or your patients, and it's engaging the ventral vagal system. So we talk about glimmers often when we talk about mindfulness, and mindfulness is paying attention to the present moment without judgment and just with ultimate acceptance. Mindfulness is also an important part of staying in or moving into the ventral vagal state, which is that safe, right? That safety, that feeling that everything's good in that moment. So from sympathetic to ventral, so some tools that are really helpful to get into the state are glimmers. So it says we need the most tools and strategies to help us move from this sympathetic to ventral. And another way of saying that is movement from stressed out to self-regulated. Right. So look at this right here, from dorsal to sympathetic to ventral. So it says when you're bottom ladder, right? So when you're in a really low state, you can listen to high beat music and dance like no one is watching, do some jumping jacks or a hit sequence. You can gargle water. You can rub your hands in cold water, splash cold water in your face. So you're really trying to get the body into that ventral state, which is so important. All right. The self-regulated your nervous system. This is also very important as well because you want to get yourself back into that ventral state. These are also ways and reminders to make sure you get back there. All right. So I believe we have the somatic flashcards. And I ended up not putting them out in here, but I do believe that they're in here. So I will get those at top for you guys as well. But building somatic awareness is important to understand boundary development, and many of us do not have good boundaries. You know, I think if you're a nurse or a healthcare worker, a lot of times you are a people pleaser. And so this is really important when stepping into the role of healthcare is to understand boundaries because they're going to walk all over you if you don't. So understanding boundaries can help us cope with future stressors or situations. And, that may be more physically or emotionally challenging. Breathing, although it's simple, it's your nervous system shows how you're breathing. So if you're breathing really shallow, it can be, that you're kind of in that fight or flight state. So coming back to being mindful of our body can decrease the inflammation with breathing because it gets us to a regulated state. Grounding, and this is a really good one. So if you are perceiving danger, whether you're at your work or if a client feels like they're perceiving danger, simply acknowledging into the present moment. You can splash cold water on your face, do some controlled breathing. You can tense and relax different body parts like we do sometimes before our sessions here. And then also just make your body move in a different way. So instead of just standing, like reaching out to the sides, like just kind of moving the body different ways. And then pendulation is like swinging. So it's, you can just, you can kind of feel like your body going from different emotional states. So you want to try to get it into that center where you feel like you're co-regulated. So it's almost like a pendulum swinging with the emotional states. All right. So let me go ahead and stop my screen here. I just have one more that we're going to go over today. And this is going to be homework for you guys. Sorry, my nose is itching. And with this, I'm going to share my screen again. There we go. Okay, here we go. So boundaries, homework for personal space. So we have our personal space, and in this right here, there's some inquiry questions. So it's, how would you describe your personal boundaries? How can you tell where your personal space begins and ends? What do you feel in your body when someone comes too close to your personal space? What do you feel in your body when someone's too far from your personal space? Draw your personal space, make it a circle around the figure to indicate your personal space. So you do that right here. What color would your boundary be? What material would your boundary be made of? And who is in your personal space and who is not? So I think this is really important for clients to understand, our personal space is very important to us, and it's our energy that we have to manage. So people that might take our energy from us might not be as close in our personal space as other people. So these are really good exercises to do, especially with this one. When boundary is violated, redrawing the territory, right? So sometimes we have to redraw the territory of our boundaries. Personal space and relation, there's a couple of different things here. Draw your skeleton. Nonverbal communications chart. I thought this was kind of cool because you can look at these different ways that we non-verbally communicate. And so you might be a little bit more aware next time that you are speaking to somebody. These are some body language signs. As you can see, we do this. This is our victory pose. Elated, bored with hands both on the face. Thoughtful is a hand on one of the sides of the face. Defensive might be arms crossed. Depressed is head down on top of hands. And then as you can see, the V is a showdown trying to display the defense, right? So I think this is cool. What gesture do you observe? What did the client report at the time? What was their effective emotion? So it goes a bunch of different worksheets here that you can also use. This is really good too. Positive beliefs, this is really important, especially these like limiting beliefs right here, is bringing them into positive beliefs. And so you can even focus on themes each week for your clients, which I've done as well. And that can be really helpful for clients. All right, so when we are looking at emotions in the body, we can really see a theme in the different body parts. So we talked about last week when we talk about shame, grief, anger, hate, some of these emotions really start to sit in the heart. And as we know that heart disease is the #1 killer in America, we have a lot of people that need to deal with that. So if you are a cardiovascular nurse, it's really important to have that patient be referred or have somebody work with them in regard to their emotions. So it could be like a social worker, a psychologist, or even you, because you're a somatic nurse, but have them really kind of tap in and become aware of these emotions that they might be harboring, because they might be one step away of actually feeling better, of being able to control the situation rather than being a victim to the situation. if we look at stress in regard to other body parts, we can see that over the last couple of years, we've had different diagnoses of gut problems come up, digestive problems come up. And much of the time, that's related back to stress, that your body is in a state of fight or flight all day long. And so when it is stressed, your stomach and your body is going to amplify that, whether it's going to be overeating, which causes inflammation in the body, or undereating, which also causes inflammation in the body. And as we get down to the pelvic area, that fight or flight response so often is harbored in our hips. So when our hips are tight, if you think about what kind of organs are in that bowl of our pelvis, we come to our sexual organs. And so some of the times that I worked with clients that are trying IVF with unsuccessful attempts, and they come to me and I'm like, you guys are so stressed out and you're not connected and you're so disconnected. And maybe that's why you're not getting pregnant here. So when we start bringing their nervous systems back into co-regulation and we start to allow them all to move through some things that might be harbored in the area of the pelvis, that a lot of times opens up the body to receiving and allowing a woman to get pregnant. And sometimes the sperm count might be low because the male is stressed. So it's important to look at the emotional aspect in any disorders, disease, procedures, or treatment, because ultimately it comes down to the emotions of the experience and how that's going to be harbored in the body. And sometimes we see this much of the time with patients that have gone through trauma in the ICU or the ER, that they come out and they display this symptomology and they eventually come with chronic diseases, mental health disorders, because of that experience, that one experience that happened to them in the hospital that they wanted to get help from. So it's a very interesting concept to think about and talk about. But definitely, reframing the mindset is going to be a huge positive, um, because the mind is so important. So you can look through some of these workshops or worksheets. As you know, I'm not sharing my screen right now. I'm just kind of going through some of these. There's also a tracking your own nervous system, which I think is really important. It's tool 102. And this allows you to understand, what it says, what makes you feel connected, what makes you feel active. Let me show this so you can see it. It's this tool right here. What makes you feel active? What makes you feel calm? How do you reach out? What works? Is a social engagement. How do you support your engagement with others? How can you create healthy habits to train your calm state? And then it's expand the window of tolerance. And if you are familiar with the DBT book, right? Yeah, DBT book is out here. We have a area in there about radical acceptance, and radical acceptance is really important to just kind of come back to the present moment. But if you take a look in your DBT book, I'd like for you to check out at the beginning, there is a page that you can document every day. Mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness skills within this book. You can also look at self-care, to-dos, today's strongest emotions, what happened that caused these emotions. So like what was triggering for you, thoughts that I had were related to these emotions. What are these emotions telling me? How can I cope? And then daily gratitude. So I really love these worksheets at the beginning of the DBT book because they're very helpful. And, you can always reuse these by, laminating them if you want. And then also in this book, it's important to go to and really start to learn the emotions list. Right. So you have the emotion wheel, then you have the emotions list. And these two are really good when you have a client, and you can even, print this out and hang it up or take it with you. When you have a client that's feeling distressed and all they're saying is, I'm bad, I feel bad, I feel bad, you can whip this wheel out and you can go to where it says bad, and you can go, are you bored, stressed, tired, or indifferent? And they're going to be like, I'm stressed. And you're going to be like, okay, do you feel rushed, pressured, overwhelmed, sleepy, out of control, busy, unfocused, or even apathetic? So it really helps narrow in what kind of emotion somebody's having, and then you can come up with an action plan from that emotion. All right, guys. If you have any questions, please put it in the community discussion area and I will make sure to answer that. Other than that, that is all we have for today. Please review module 3, the first and second one, and then we'll be diving more into the DBT skills on Thursday. I hope you have a good week, and I'll see you on Thursday.